It's my pleasure to be able to share with you some of the findings and the ways in which FAWEZI Zimbabwe, Miske Witt Associates International, and UNGEI have been working together to use data from the pilot on SRGBV prevention in Zimbabwe. The findings here are distilled from a 40-page baseline report with over 80 pages of indices. So I'll be giving a very brief background to the pilot. I'll give an overview of its research foundation, the whole school approach, the partners, the data collection instruments, key findings, and finally using baseline findings to guide the next steps in prevention and response. After the convening of the Global Working Group in 2014, Jenny Parks and her colleagues from the University College of London, the Institute of Education, prepared a rigorous review of global research evidence on SRGBV in 2016. Building on this review, the Global Working Group and UNGEI developed the document you see on the left, A Whole School Approach to Prevent SRGBV, a guidance document with which many of you are very familiar, which offers guidance to policymakers and practitioners in designing a school violence prevention program and strengthening response actions. The graphic on the right of the screen shows the 8 domains of the whole school approach, several that will be mentioned today, including effective leadership and community involvement, codes of conduct and school rules, and addressing incidents of violence and improving reporting. An effective whole school approach includes collecting and using evidence from these domains to enable school stakeholders to come to a shared understanding of SRGBV and then to change harmful patterns of behavior over time. The approach targets SRGBV drivers that perpetuate or drive harmful actions. Some illustrative drivers of SRGBV include rigid gender roles, stereotyped constructions of femininity and masculinity, the normalization of violence against children, silence around violence of women and girls, socioeconomic inequality and discrimination, and weak implementation of institutional frameworks, laws, and policies. The purpose of this pilot is to test the theory of change for a whole school approach. The theory of change states if the drivers of SRGBV are identified in context, and if interventions based on the minimum standards are designed to address these drivers, these interventions will contribute to an enhanced system of reporting and response and to a decreased tolerance of violence, and it will decrease the prevalence of SRGBV in the long term. The central evaluation questions to help us understand if this theory of change is, if it works, include what is the status of stakeholder knowledge, attitudes, and behaviors related to the drivers of SRGBV, with a sub-question, how do these things differ by stakeholder group, students, teachers, and others, by gender, and by primary versus secondary? And how do they shift or change over time? We'll ask at the end line. And the second question is, in what ways do the 10 schools support or not support the minimum standards of the whole school approach? Whether and how do schools shift or change in supporting the standards as they participate in SRGBV programming will be asked at the end line. To carry out the pilot, FAWEZI Zimbabwe is the national implementation partner. Miske Witt Associates International is the learning and evaluation partner. From the outset, it was clear that as partners, together with UNGEI, we would not operate independently, but collaborate and support each other. We began by developing a joint work plan, identifying who would lead and who would support on each activity. FAWEZI began by building on its relationships with Zimbabwe's Ministry of Primary and Secondary Education, or MWAI, with its Department of Learner Welfare Services, to request identification of 2 districts. They identified Chitungwiza and Shamva for the pilot, and district school inspectors and local stakeholders in these 2 districts identified 5 schools in each as pilot schools, based on the school's high incidences of learner welfare issues and reported or suspected cases of SRGBV at these schools. In 2019, in June and July, FAWEZI and Miske Witt collaborated on school visioning workshops. They introduced the whole school approach and built consensus for the project with stakeholders from the 10 schools, and Miske Witt collected data together with FAWEZI. Then Miske Witt designed and conducted the baseline study with FAWEZI participation in the data collection. This was before any activities began, and Miske Witt proceeded with the data analysis and write-up with input from UNGEI and FAWEZI to the draft report that was prepared in December of 2019. Simultaneously, materials development was going on for future workshops with collaboration there, and FAWEZI led the Preventing SRGBV workshops for teachers in September and October. Since this was a mixed method study, both quantitative and qualitative data were collected. The left-hand column of the chart lists the instruments, 3 qualitative and 4 quantitative. The surveys included items on the drivers of SRGBV and items related to the minimum standards of the 8 domains. Using tablets for these surveys increased the interest in people using or filling out the surveys. We then proceeded with the analysis, and I'm going to save a discussion of that analysis for another occasion and move into what the findings were. Starting broadly with gender norms as drivers of SRGBV. Gender norms, defined by UNICEF, are ideas about how girls and women, boys and men should be and act. Internalized early in life, they can establish a cycle of gender socialization and stereotyping. The results here, and for each of the following drivers and areas, the results are shown according to the following general pattern. The findings in red and orange highlight areas for improvement, where stakeholders' views about women and men or girls and boys are not equitable and can lead to ongoing violence. And findings in blue and green highlight areas where schools are meeting the minimum standards or where stakeholders have more equitable views. With regard to roles of men and women, stakeholders thought that both boys and girls should be educated and should share household chores. They also held more traditional views regarding, for example, women's and men's roles in the family. They agreed that a woman's role is taking care of the family. In general, girls and women held more equitable views regarding social norms, attitudes, and policies than boys and men. And adults held more equitable views regarding social norms, attitudes, and policies than compared to learners. Boys and men's attitudes and beliefs were that they were entitled to have more benefits and more power than girls and women. Though this finding is not surprising to those of you listening to the webinar, this provides data in context to share with stakeholders to allow them to reflect on these inequalities and to consider them and their relationship to everyday life and to schooling. The findings in relation to beliefs, attitudes, and behaviors related to violence that perpetuate or that drive SRGBV, again using a similar color scale and charts related to results, that charts the results related to gender-based violence, stakeholders all disagreed with violence against women at home, and yet they accepted violence against children at home and at school, the corporal punishment, and they considered violence to be normal. This normalization of violence, together with what we're seeing as a lack of clear laws and policies for reporting violence, led to no one talking about violence or the silencing of violence. The inconsistencies regarding corporal punishment and hitting children is key here. 52% of the visioning workshop respondents reported that teachers punish students by caning or hitting them, and more learners agreed to that than did adults. And 40% agreed that it's all right for teachers to hit learners if they're late for school, with primary students, adults, and women agreeing more, even though the laws prohibit the practice now. Teachers interviewed were aware of the policy forbidding corporal punishment, and they were also familiar with the ministry guidelines prescribing when and how corporal punishment should be administered. So an inconsistency regarding this law and policy and practice is key. Key findings in the domains show us how the mixed methods aspect of the study is critical. The domains we're discussing here look at the school rules and codes of conduct and school leadership and community engagement. We found discrepancies in what stakeholders reported via surveys and what data collectors observed and heard from interviews and focus groups. Stakeholders agreed that school rules included SRGBV, and all schools reported active school development committees working toward SRGBV prevention. However, from the 10 schools, none of the physical copies of the school rules we looked at clearly defined SRGBV or violence. The whole school approach clearly needs to be continuing to look at these, looking at this aspect of what's going on in schools. In order for the whole school approach to be effective, it needs to align with national policies, and its school codes of conduct and rules need to align with these national policies and district policies as well. The government of Zimbabwe has laws and policies to prevent gender-based violence, including the Zimbabwe National Gender-Based Strategy, the National Girls Young Women's Empowerment Framework, and others. And the Ministry of Education, the Ministry of Primary and Secondary Education circulars are also related to SRGBV. From 2018, we have the implementation guidelines for the institutionalization of the guidance and counseling programs in all primary and secondary schools. And prior to that, the compulsory establishment of child abuse prevention and management reporting structures at every educational institution under the purview of the ministry. While these policies exist, there's also, according to the research, according to the study, weak implementation. Some of the laws and policies for reporting violence are unclear, according to the stakeholders. The reporting mechanisms and processes vary from school to school. There's a lack of clarity on reporting and a lack of follow-up. Policies have inconsistencies, for example, such as corporal punishment that I just described. With this array of findings, how are the baseline findings being used to guide the next steps in prevention and response? This is really at the heart of the presentation. First, FAWEZI used the findings to steer its 2020 implementation in February and March of this year, sharing findings with stakeholders and policy implementers. They used some of the findings with group discussions. They broke the groups into the officials into small groups and had them discuss some of these findings. And they also used them to share the information with officials at various levels. Miske Witt provided supporting materials, a 3-page summary, a 1-page summary, and PowerPoint presentations to share the findings. FAWEZI is going to continue to work with the 10 pilot schools on the minimum standards and school stakeholder SRGBV prevention plans as allowed by COVID-19 and the crisis. They'll continue to work with the pilot schools in these ways, developing a shared comprehensive definition of SRGBV, encouraging the development of this with school stakeholders, developing codes of conduct and school rules, including this comprehensive shared definition, and strengthening working groups for SRGBV prevention at the school level. How has the COVID-19 pandemic affected the work of the pilot? Schools were closed in Zimbabwe on the 24th of March, a week before the actual last date of the term, for the first term for 2020. The opening date for term 2 is the 5th of May, but citizens are not yet sure whether this will be followed. UNGEI and UNICEF have shared resources that have been prepared for this time of the pandemic with FAWEZI to share with the Ministry of Education. FAWEZI has issued its own statement that's on its website with regard to how it is responding to the pandemic. If possible, they will continue to work with, to expand the initiative with leaders in the 2 districts through 2020 on the whole school minimum standards. They had invited all of the head teachers from one district, from each of the districts together to a meeting, not only working with the pilot schools, but then expanding it to the entire district. They also plan to work with partners and the ministry at various levels on policy coherence and alignment with practice in schools as possible, for example, on attitudes toward and practices of corporal punishment. So if we return to the theory of change, if the drivers of SRGBV are identified in context, and if minimum standards are designed to address these drivers, these interventions will contribute to an enhanced system of reporting, etc. At this point, we've completed the first 2 clauses. The pilot has identified the drivers of SRGBV in context and is working on the minimum standards-based interventions to address these drivers, working with the schools as they develop their own action plans and so forth. One thing we've realized is not in the theory of change that is critical, and that is if school communities develop shared definitions of and understandings of SRGBV. Since we have a difference in what people are reporting as SRGBV, the number of incidences that are different that they're reporting, and the different definitions, there needs to be this agreement at the forefront and at the beginning of the work. So we're off to a strong start. This was conceived of as a 2.5-year intervention, however. For various reasons, it's been reduced to a 1 year, So it's important to ask what's realistic to expect at the end of the first year. First of all, the baseline was conducted in September 2019. The end line probably will not be able to be, or may not be able to be conducted in September 2020. It may be delayed until 2021 so that there is more time for the interventions to be implemented in the schools by the various stakeholder groups. But we've ended up with a complex set of baseline findings that differ by gender, by age, and grade level. It suggests that schools will need to refine their work refine the work and work with the schools on refining the action plans. Especially in primary, we need to work with the learners who think that it's okay for their rights to be violated and okay to be beaten, working on the empowerment of child rights. And FAWEZI, subsequent to this baseline, has introduced a learner-led TUSEME program so that students are, in fact, together with teachers, working on looking at these issues and matters of SRGBV. Given the low rates of disclosure reporting that Together for Girls told us about, although we don't have this data for Zimbabwe, we can anticipate that increasing the rates of disclosure on SRGBV will be very difficult to get, and we'll need to focus on this much more than what is appropriate in context. The guidelines suggest that in 1 to 5 years, it will take for a school to become, address school-related gender-based violence appropriately. However, given the challenges that we see, the multiple challenges in the context and depending on resources, I would speculate at this point that we should be thinking of at least 5 years and continue to be thinking about ways in which we can continue to collect the data to follow 1 year at a time how this pilot is rolling out in terms of developing this very promising whole school approach. Thank you.